Dinstein on yhtiön ylilääkäri.
Mazor Robotics is an Israeli startup company that was founded in 2001 by Professor Moshe Shaham of the Technion Institute of Technology in Israel. It's a company that is dedicated to developing surgical robotics that are bone-mounted for spine and brain surgeries. We have already the second generation of our system. It's called Renaissance Surgical Guidance Robot. There are about 70 of these spread around the world, and we have done almost 10,000 of these surgeries on patients in probably more than 15 countries. Patients suffer from back pain. About 80% of the population suffer from back pain during their lifetime and will seek medical assistance. Medical assistance can be conservative treatments, but in some cases they will deteriorate and will require surgical correction of their condition. Surgeries can be from small, relatively short surgeries like a disc removal, and can be very large and complex surgeries such as correcting a spinal deformity. Scoliosis is an example, kyphosis is another example. These take several hours, sometimes even many hours. A lot of blood loss is often involved, and it is a very intensive work for the surgeon. The surgeon cannot be tired in the middle. Every screw is important. The spine is a very unforgiving neighborhood, and accuracy is the fundamental of this surgery. The way a surgeon works with a robot is to acquire a CT of the patient's spine and plan the whole operation before even entering the operating room. Usually, spinal surgery is performed in an open approach, meaning that the skin is opened, the soft tissues underneath, the muscles and everything, are moved aside to expose the spine. Minimally invasive surgeries are not very common. They demand a greater accuracy without the surgeon being able to see what they're doing. A system like our Renaissance robot allow for minimally invasive surgeries, so by using the robot in a minimally invasive approach, you can minimize blood loss, you can lower infections, you can shorten the length of stay in the hospital because the patient, after a minimally invasive surgery, is in less pain, it can convalesce faster, go home earlier, and suffers fewer medical complications, not just fewer surgical complications. Patients who hear that a robot is involved in their surgery are very excited. In fact, we see that some patients will go to another hospital only because the other hospital has a robot. They will seek centers that have a robot that will allow them to have a less risky procedure. Surgeons have a mixed reaction. Some of them are not early adopters and do not jump at any new technology. But the ones who are more thought leaders, who are more interested in technology and have a vision for the future of surgery, are very excited. They adopt it with great enthusiasm and great success as well. Hospitals, the ones that wish to communicate to patients their commitment to clinical excellence and their ability to adopt new technologies to provide better health care for their patients, are also very excited to maintain their leadership position. So we are very fortunate to be able to work with thought leaders among spine surgeons and among hospital administrators, and to be able to deliver higher healthcare quality to